Good, happy Thursday morning, October 14, 2021. I'm Riley King, and welcome to this Thursday morning edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Thursday morning, so let's get started right now. First up, New Hampshire Executive Council rejects $27M in federal vaccination funding in party line vote. Let's take a listen to that video from WMUR News 9.
Everyone has mental health. Is yours keeping you from the life you want? Riverbend is here for you, providing mental health services for all needs and all ages. Specialized treatment delivered with compassion. Visit us at riverbendcmhc.org.
Outburst after outburst. In all, 9 people were arrested, despite the fact that Republican executive councilors sided with those anti-vaccine mandate protesters. On a party line vote, the council rejected $27 million in federal vaccine funds.
But at this time, I think we have alternatives for funding right in front of us that we can use as we address the disinformation and fear.
Republican councilors are concerned by accepting the money, the state could be forced to follow a federal vaccine mandate. The governor, public health department, and state attorney general have all disagreed. Sununu saying the state has accepted other grants this year with the same language, and said this to GOP councilors' suggestions that he do more to stop vaccine mandates.
Government is telling businesses how to run their business. That isn't even socialism. That's actually pure communism.
Well, I wasn't talking about how
let's be very careful about what you're implying.
During his COVID-19 press briefing after the meeting, the governor said he doesn't know of any other state that has denied these grants.
Today's vote by members of my own party, frankly, was a disservice to the constituents that we are all elected to serve.
Sununu calling the vote a reckless disregard for the lives lost from COVID.
And the rejection of these funds shifts our state response efforts to an already burdened healthcare industry with testing and vaccinations and other critical needs.
Now, this fight may not be over just yet. The governor and state health commissioners say they will explore other opportunities for funding. Reporting live in Concord tonight, Mike Cronin, WMUR.
Okay, and there you go on that video and that report. Sununu says rejection of federal COVID-19 funds will increase burden on healthcare system. Let's take a listen to that video from WMUR News 9.
Everyone has mental health. Is yours keeping you from the life you want? Riverbend is here for you, providing mental health services for all needs and all ages. Specialized treatment delivered with compassion. Visit us at riverbendcmhc.org.
State epidemiologist Dr. Benjamin Chan says the COVID test positivity rate has risen, and while children make up about a quarter of new cases, cases are increasing across all age groups. He says the majority of the deaths in the last few weeks remain outside long-term care facilities, signaling continued community spread, and continuing vaccination is key.
This is, especially in the coming weeks and months, where I think we really are going to be trying to shift and needing to shift our focus when the Pfizer-BioNTech vaccine is authorized and recommended for use in 5 to 11-year-olds. Another whole group of the population of New Hampshire that will do the work to try and make vaccines available to them so that they can be vaccinated.
The governor says while vaccine will still be available to anyone that wants it, the $27 million sent back by the Executive Council will impact the process and puts pressure on the ability to manage the pandemic as a whole.
Because we're going to have to ask our traditional healthcare facilities to do more. The regional public health networks who were providing the vaccines, for example, to first responders, they were going to do the vaccine clinics for kids in schools. That's where that funding was going. And so now that that's not happening, there is a domino effect here.
The governor also says the FDA may soon authorize the Johnson & Johnson and Moderna boosters, and he says when that happens, the state is ready to roll. We're live in Concord. Jennifer Crompton, WMUR News.
Okay, and there you go on that video and that report. Coos County cases climb, straining resources for healthcare providers. Let's take a listen to that video from WMUR News 9.
Palmer Gas and Oil has been keeping homes in New Hampshire, northern Massachusetts, and southern Maine comfortable for over 85 years and 4 generations.
The city of Berlin and other surrounding Coos County communities have fared well during the pandemic, but now it's experiencing its strongest surge in cases.
Our cases, both in Berlin and in terms of the county, are the highest that we've seen since the pandemic began.
Androscoggin Valley Hospital in Berlin is feeling the strain. Staff is limited, some sick themselves, and they're tired.
We're also seeing a heavy volume in terms of our ICU patients and honestly, patients that, are struggling to make any progress against this.
AVH is now transferring patients to other hospitals to make room for those seeking treatment for the virus. But even that is now difficult.
We have a lot of facilities in the state that are seeing similar problems. We're having difficulty in terms of transfer needs to other facilities for care.
There's not a lot of room left at the hospital, but yet the cases of COVID continue to rise.
Berlin Fire Chief Jay Watkins also serves on the Emergency Management COVID Task Force for the Valley. He's now making a plea to the public to help ease the burden on the health system.
We are kind of in a bad situation. Let's try to go back to do those good things that we're known to do. Wear our masks if we're indoors, social distance. Then hopefully we can get those numbers to come down.
Now, the state is also providing more rapid tests to the hospital as well as regular oxygen deliveries. In the meantime, the chief is also asking people to get out and get vaccinated. He says he recently contracted the virus and credits being vaccinated for keeping him out of the hospital. Reporting live, I'm Tim Callery, WMUR.
Okay, and there you go on that video and that report. Two more Granite Staters die of COVID-19 as cases rise again in New Hampshire. Let's take a listen to that video from WMUR News 9.
Calling all experienced fuel delivery drivers, HVAC techs, and installers. Palmer Gas and Oil is growing, and we want you...
Just a brief update for today. First, the numbers. We are reporting 510 new infections, new people diagnosed with COVID-19. The last week, we've been averaging over 500 new infections per day, and statewide, there are now 4,218 people with active or current infection. Our test positivity has also increased the last week. We're now at around 6% of all tests, antigen and PCR tests combined, that have been positive for COVID-19 statewide. And the numbers of people that are hospitalized with COVID-19 have been stable but high. 140 people currently hospitalized with COVID-19 statewide, and we continue to see deaths related to COVID-19. We have 2 new people to report today that have died from COVID-19, bringing the total pandemic total to 1,511 people that have died from COVID-19. Neither of these 2 new individuals was associated with a long-term care facility. And to put this in perspective, in the last week, there have been a total of 17 deaths that have been COVID-19 related that have been identified and reported out. The vast majority of these deaths are occurring outside of long-term care facilities, which is very different from the early days of the pandemic. COVID-19 vaccines remain readily available and are still the most effective and safe way to prevent COVID-19 and to control spread of this pandemic virus. We continue to strongly recommend and encourage anybody who has not yet become fully vaccinated to take the step to do so. People can go online to vaccines.nh.gov to find a location to be vaccinated. We also want to remind people that outpatient monoclonal antibody therapies are still available and readily accessible for people that have become infected with the COVID-19 virus and are at high risk for progressing to severe disease. These monoclonal antibody therapies have been found to reduce the risk of hospitalization and death after infection. One formulation has also been authorized for use to prevent infection after an exposure, what we call post-exposure prophylaxis. And just as a reminder, there's a list of locations around the state that are administering these monoclonal antibody therapies on our website. People can go to covid19.nh.gov and look at the treatment resources section of our website to find locations. But we encourage people to talk with their healthcare providers about referral for treatment if they are at higher risk for progressing to severe disease and have become infected. But these monoclonal antibody therapies and other treatments do not do away with the need for people to get vaccinated. COVID-19 vaccination is still the most effective, safe, and important way that a person can protect themselves and protect others. And again, to find a place to be vaccinated, people can go on the website vaccines.nh.gov. That's vaccines with an s.nh.gov to find a place for vaccination. And with that, I will turn things over to the Commissioner. Thank you.
Okay, and there you go on that video and that report. Warner man says he regrets not getting vaccinated after brush with death. Let's take a listen to that video from WMUR News 9.
So, you need a new roof, but you have so many questions. Should I get a metal roof or asphalt shingles? Are the materials and workmanship both warranted?
Love you.
I love you too.
Valerie Dow really meant the part about through sickness and in health all those years ago.
You can FaceTime from anywhere, but my husband is in that room. My husband needed me, and I needed him to know that I was here, and I wanted him to draw every bit of strength he could from me.
This preschool teacher is vaccinated. Her beloved is not. He says it was part resistance, part procrastination. He regrets it now.
If you're not vaccinated, please go get vaccinated because you don't want to be where I'm at.
Scott says it started with incredible fatigue, and after he was admitted, his oxygen levels plummeted. Doctors were talking about a ventilator. Scott was terrified.
I started making phone calls. I called my mother, said goodbye. I called my kids because I didn't know.
Val wouldn't hear of it. No dying. So here she sits, willing Scott to pull through. The nurses could feel this connection, and despite the long hours, the endless rotation of really sick patients, found time to do something more.
One morning I come here, and I don't remember now what day it was, but he was still fighting for his life. And I look up, and there's a sign that says, "Hi, Val," with a heart on it. Oh my God, I cried. It was just beautiful.
Today, doctors told Scott and Val he's on track to go home on Friday. In Concord, Amy Cavino, WMUR News.
Okay, and there you go on that video and that report. Tuberculosis case confirmed in Concord School District. Let's take a listen to that video from WMUR News 9.
For over 85 years and 4 generations, award-winning Palmer Gas and Oil has been serving communities throughout.
Tonight, officials at Concord Public Schools are handling a case of tuberculosis linked to Concord High School. School and health leaders are already reaching out to people identified as close contacts. The infectious disease spreads mainly through coughs and sneezes and mainly affects the lungs. The case also has the attention of state health officials.
And we will begin, have already actually begun the process of contact tracing. Sounds familiar to what we've been dealing with.
We are investigating a case of tuberculosis that is associated with the Concord School District system and have been just recently reaching out to the school system to try to figure out what if any, exposures may have occurred.
There will be a virtual meeting tomorrow for families and faculty to talk with school leadership and local doctors.
Okay, and there you go on that video and that report. Biden meets with business leaders over Bottleneck. Let's take a listen to that video from ABC News.
Good evening. It's great to have you with us on a Wednesday night. I'm Whit Johnson in for David. And we begin with the crisis in America's supply chain. Empty shelves, long waits for online orders, and rising prices for gas and other vital supplies with the holiday crunch fast approaching. Tonight, President Biden vowing to act, bringing business, labor, and shipping companies together to end the bottleneck. We've been reporting on the traffic jam at the nation's ports, cargo ships waiting for days to unload, a shortage of workers on the docks. Once on land, more delays, not enough truck drivers to move the goods. Shoppers finding bare shelves, many items from toys to toasters in short supply. All of it contributing to rising prices, especially painful at the pump. And this just in tonight, what won't help anything, a large fire breaking out near shipping containers at the Port of Los Angeles. Tonight, that same port has agreed to operate around the clock. Union workers will put in longer hours, and shipping companies will speed up deliveries, working to untangle the snarled supply lines. ABC's chief White House correspondent, Cecilia Vega, leads us off.
Tonight in Long Beach, California, at what should be one of the busiest ports in the country, a fleet of container ships sitting idle, containers stacked high, waiting to be unloaded. The bottleneck leading to a crisis in America's supply chain. Now facing skyrocketing prices and bare store shelves, President Biden is vowing to act.
We're going to help speed up the delivery of goods all across America.
In the midst of the global pandemic, the cost of shipping containers needed to move goods from Asia to the U.S. soaring. Plus a shortage of workers, from longshoremen on the dock to truck drivers, all leading to scenes like this. Empty shelves at Tim Metcalf's grocery store in Wisconsin.
The supply chain issues we're having are really kind of from soup to nuts.
He says he's seeing price hikes across the board, and he's not alone. Americans are paying more for everything, from diapers to new cars, up more than 8%, and clothes up more than 3%. And it could get even worse as the holidays approach.
With the holidays coming up, you might be wondering if gifts you plan to buy will arrive on time.
Americans are looking at shortages on things like toasters, sneakers, bikes, and toys.
There are certain things that are not coming, that will not be here. I know a lot of toy makers that we have talked to have looked into renting their own planes, putting things on trains, renting their own trucks. I mean, it's been dramatic.
Tonight, the White House praising news that the Port of Los Angeles will now run 24 hours a day, 7 days a week. Union workers will put in longer hours, and shipping companies like UPS, Walmart, and FedEx will increase overnight hours to get the goods on store shelves.
The commitments being made today are a sign of major progress in moving goods from manufacturers to a store or to your front door.
Cecilia Vega is joining us from the White House tonight. And Cecilia, as we see this rising inflation, you're learning tonight that seniors will soon get more money in their pockets through Social Security.
Yeah, exactly. A nearly 6% cost of living boost in those Social Security checks. This is an increase. We haven't seen an increase like this in nearly 4 decades. It's supposed to help offset some of those price hikes and those essentials that we've been talking about, like food and gas. So tonight, some good news for the average American retiree who is now looking at $92 more a month come January, Whit.
Many hoping that does make a difference. Cecilia, thank you.
Hi, everyone. George Stephanopoulos.
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast, right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. Thank you for tuning in and watching this morning edition of the Riley King Newscast. Goodbye, everyone.